You may be struggling if your loved one should receive catheters such as a PureWick system or condom catheter. I'm here to help you and answer your questions. I'm Bienstock. I'm a board-certified plastic and reconstructive surgeon. I specialize in wound care and those that are homebound and bedbound. So a lot of my patients are primarily homebound and bedbound when having continence, meaning they can't control the urine and or feces. Today we're going to talk about different catheters. So I'm not a big fan of indwelling catheters. This means this is a catheter that goes inside the urethra, both either in the man or the woman. For men, sometimes people recommend the condom catheters. This can be a great solution if urine becomes a really huge mess, but there are issues with having a condom catheter. You have basically a condom which hooks up to a tube, and the condom can be on the penis, which can cause a lot of irritation and rashes and actually cause wounds. So it's not that it's a bad thing, it's just something I would avoid if we can absolutely avoid it, meaning that you can wear diapers or use what's called bedside commodes, these little tubes that people can urinate to. Now, your loved one who may have dementia or some other cognitive dysfunction, they're not able to do this. You can still wear diapers, and we talked about previous sessions of having a diaper on, but leaving it open, meaning the tabs are open, so the diaper becomes avoiding bucket, essentially. So if you're not able to achieve this, a condom catheter is a decent option. I'd not recommend having 24 hours a day. You want the skin on the penis and the shaft to be able to breathe. As I said, I recommend trying to avoid as much as you can. In terms of the PureWick, this is an external catheter system for women. What it does is it goes inside the folds to make, so when women urinate, it's hooked up to suction, and all the urine goes away from the backside or the perineum, as well as the anal area and iliac area. This can be great in terms of preventing urine from getting in the wound. However, the diaper has to be on, and as we discussed, a lot of my patients suffer from having rashes, either diaper rash or other things there where the skin doesn't breathe. And also there's a steep learning curve for the PureWick. In the hospital, a lot of the nurses are trained very well how to use a PureWick, and it would be great. When it doesn't work, it's disaster, because you basically have a catheter foreign body in between the folds in the women's private parts, which can irritate and cause a wound or a maceration. So it's not that it's such a bad option, but it has to be done correctly. For me, I don't generally like it. I like the diaper to be left open to air, and when gravity will pull the urine down into the diaper. However, if this is the only option to prevent urine from getting into a wound or irritating the skin, it's a fine alternative, but you have to watch videos and really master the technique of doing this. If you have any questions or comments about catheters such as a PureWick system or a condom catheter, please let me know below, and make sure you subscribe to the channel when you get a chance. Thank you so much, and I look forward to our next session.